guys, welcome back to yet another episode of my oral health diaries. I hope you've been catching up on the previous episodes. For those who are new here, my name is Dr. Kendi. I'm sorry, I always forget to introduce myself, but my name is Dr. Kendi, and welcome to my oral health diaries. Today we're going to be discussing intrinsic tooth discoloration. I'm sorry, I've just gone right into it. I'm assuming we are all following on the series. So this week is intrinsic tooth discoloration. Disclaimer, this may be a very prolonged kind of topic because the reasons for intrinsic discoloration affect a lot of people, and the sad thing is they're very difficult to manage. So I feel like we need to take a bit of time to discuss each and every one that I feel is very common in the Kenyan population. So forgive us if we stay or if we take a bit too long under this topic, but it's going to really benefit you. So let's take our diaries and let's go right into it. Now, with intrinsic tooth discoloration, the discoloration is not as a result of something that has deposited onto the tooth after the tooth has come into the mouth. It is as a result of either interference or let's just say something is not okay when the tooth is forming. Okay, so teeth are continuously developing in your bone from the time you're intrauterine up to the time when you actually get all your teeth. Please believe it or not, I know. Anyways, for dentists, I'm like, it's quite obvious, but I've told my patients this severally and it's quite amazing. But the truth is that teeth actually develop. Initially, like from about 4 months intrauterine, your teeth start forming when you're still in your mom's womb. So you're 4 months, hapo hivyo, your teeth are forming. They start like very little tooth buds, just the same way like a child develops from just a little cell. The same way the teeth start developing just like that. So from the time you're still in your mother's womb, but that's at around 4 months, up until you're about probably 8, 10 years, your teeth are still forming. So it's a very crucial time, and anytime there's a disturbance in tooth formation, then the consequences are witnessed when the tooth erupts. So the issue is normally with the structure of the tooth rather than last week's discussion where we said the tooth is in the mouth and then all these other things just come and kind of attach onto the tooth. Now, under intrinsic tooth discoloration, one thing that may cause that is a metabolic disturbance. Now, when we talk about metabolic disturbances, there are quite a number. I'm not going to get into it because it's quite like, it's a bit too much. I feel like this is a good discussion to probably have on our Instagram page, and probably medics and pharmacists jump right in and help us with this because we actually need to learn more about it. They may not be very common conditions, but there are things that happen. Things like alkaptonuria or congenital, they even had congenital erythropoietic porphyria. Anyways, make sure you follow us on Instagram so that we can discuss these metabolic disturbances, okay? So that we can learn what happens when a child has this issue or an individual has this metabolic issue. How does it consequently affect their oral health, or how do their teeth form or manifest? Sometimes as a clinician, you can actually pick up something that has not been found just by looking at the oral cavity. Now, a very common one that I feel I should mention, other than the ones we're going to be discussing on Instagram, so make sure you're there, is something we'd like to call a Melogenesis imperfecta and dentinogenesis imperfecta. Now, we said during our introduction that the tooth has different parts. So we talked about the enamel and then the dentine and the pulp. Let me stick to the coronal portion only. So if there is a disturbance in the enamel formation during that time that, it's called a Melogenesis imperfecta because the things that deposit the enamel, they are called ameloblasts. Yeah. So now Melogenesis imperfecta, or enamel formation, is imperfect. That's basically loosely translated. That's what it means. So you get a child with symptoms that, or an individual with very thin teeth we're going to display an image to just appreciate how it would look like, yeah? So such patients would have a lot of discomfort. Not only, for them, the issue is not only with the color, but remember, because we said the dentine is darker, then these people don't have a chance to even experience having white teeth because the enamel is so thin. So their teeth are just kind of like the dentine color from the beginning. And this poses challenges like sensitivity, discomfort. There's a lot, and when caries happens, it progresses quite fast, and there are other things that come about as a result of amelogenesis imperfecta. And this is it's normally a genetic thing. There's really nothing we can put our finger on and say that this is what causes amelogenesis imperfecta. Not really, and there are different types. Again, I'm not going to go into it here on the video because we said we just want to learn the basic concepts here, but we can always discuss more out of this. Another one that's very common is dentinogenesis imperfecta. Just the way it sounds, it's an issue with the dentine formation. So if there's an issue with dentine formation, then the color is affected as well, and the tooth is not normal, okay? So that's just what it means. Amelogenesis imperfecta and dentinogenesis imperfecta. Now, why I have said that I would really like for medics and pharmacists to join in the discussion is there are also some medications that would cause tooth discoloration. The most common one would be, and for dentists we are told, tetracycline. We rarely see it now because tetracycline is rarely used nowadays, but studies are being done, and there are studies that are talking about something called minocycline, which is kind of like in the same family as tetracycline, and minocycline is actually used to treat things like acne. So in this study, they said that they observed that patients who've been prescribed to minocycline over a long duration, their teeth eventually like discolor, and if they're having children, then the same thing happens because they're in the same family. This is a nice topic to discuss, possibly with pharmacists and medics, and just hear what they have to say. So I'm going to make sure I plan on that. But yes, some medications do cause some staining. A thing we would put a question mark on is things like iron supplements, yeah? So make sure you join us as we continue the discussion. If you're on iron supplements and these medications, you need to know the consequences, especially on developing dentition. Something else that's pretty common with intrinsic tooth discoloration is something we call dental fluorosis. Now, dental fluorosis, I would say, is a patient's nightmare and a dentist's nightmare as well, because fluorosis affects the structure of the tooth, the color of the tooth, the function of the tooth. It basically affects everything. And unfortunately, in Kenya, our water reserves are quite highly fluoridated, especially in some areas. With this one, I'm going to go all out. From next week, we're just going to be discussing dental fluorosis because it's a thing that has really engulfed people in Kenya, and most people don't know why it's happening. So we are going to go into it, discuss fluoride, discuss how to treat our water to make sure we have the correct amount of fluoride. We're going to go and see how they actually do that, how they test the water, and how you can get the water filtered to the correct level so that you have a correct level of fluoride. So make sure you join us. Next week, it's fluoride for sure. So I'm not going to dwell on fluoride. Interesting series right there. Okay. Another thing that could cause intrinsic tooth discoloration is something we call root resorption. Now, for root resorption, this normally happens a lot, especially after trauma or accidents. Yeah, so if the tooth either moves or is damaged in some sort of way from the inside, sometimes ni kama inakulika, we're going to project. So your dentist, when they take an x-ray, they're going to see the root being kind of eaten up from the inside. But for you, you're going to notice that your tooth is becoming a sort of like pinkish color. Now, this pinkish color may also come about in primary dentition, because what happens for babies to lose their teeth, their root gets resorbed. So sometimes if the tooth stays around for a very long time, the root is getting resorbed very slowly. Sometimes you can notice that a child's tooth is turning pink. It's not because it's sick, it's just because the root is getting resorbed. So that's a telltale sign of root resorption. The tooth starts turning pinkish. So it can happen in primary dentition or permanent dentition. In permanent dentition is when it's more worrying because it's very difficult to fix. At least for a child, we'll just go ahead and extract and they'll get their adult tooth. But for adults, when root resorption happens, it's something that is quite complex to manage. So it is always good if you experience trauma, go to your dentist, let them treat the tooth appropriately to make sure that it doesn't undergo root resorption. Another thing that could cause intrinsic tooth discoloration is now something we call pulpal hemorrhage or pulpal death. We talked about the layers, the enamel, the dentine, and now the pulp. Now the pulp could experience a lot of injuries because of many things. Sometimes it's just the temperature, so it dies because of maybe extremely high heat, and normally it's because of restorative procedures mostly. So if you're having a filling done and the part of the tooth that's decayed is being cut out, that thermal stimuli could affect the pulp and then it could start dying. So over time, the tooth may change color. The pulp may also be dying because of decay. Decay could happen from wherever. Sometimes you don't even see the cavity. That's why we always say 6 months, get a checkup. Sometimes it's just between the teeth. That's where the cavity starts. So if the pulp dies, then you'll notice like the tooth is becoming a bit grayish, or mostly it's just grayish. So then that's a thing to actually be concerned about because it's changing the internal structure of the tooth. There are some things about intrinsic discoloration that are a bit too complex, but the benefit is for some of these things, if caught early, can be managed. Some of these things just have to be prevented, like dental fluorosis. So let's all just, learn, go to your dentist, inquire, do your research, always have a conversation with your dentist or your doctor, learn more about your health so that you're able to make better decisions. I've just had to go really fast through the major causes of intrinsic tooth discoloration or the discoloration that happens as a result of disturbance during tooth formation. Okay, so there's quite a lot there, but at least we've just gone through a raka so that we can have a general outlook. Okay, now throughout this series, as we discuss aesthetics, we are going to probably be picking on each one and expounding more. So feel free to leave your questions in the comment sections. If you have any concern, if you've noticed something that has not been mentioned, kindly feel free to comment. Thank you for joining us on this episode of My Oral Health Diaries. Next week is gonna be very exciting, so make sure you join us and don't miss out. But make sure you've learned something from this week. Thanks again, and I'll see you again next week. Hello guys, Dr. Candy here. This week we are going to be discussing intrinsic tooth. Sorry, I'm not in it. Let me be in it. That was my TikTok challenge, guys. I hope I tried. Prolonged. Sorry. Sorry. Let me get the word. Teeth consistently. Okay, let me just say something different.